I chose the medical field in particular due to several experiences growing up. I've always been academically inclined, had a big interest in the human sciences, and additionally I wanted a career that had a very deep fund of knowledge in healthcare and medicine. I wanted to be able to foster lifelong relationships with patients, in addition to stepping into a leadership role and a patient advocacy role, and by choosing medicine I was able to incorporate all of that and accomplish my goals. Family medicine, briefly, would be described as patient-centered, preventative, whole-person care, while also addressing acute and chronic needs, but also addressing multi-generational care, so I can take care of the entire family. First and foremost, what would be the most rewarding would be to truly earn a patient's trust, and then ultimately, of course, achieve whatever healthcare goal that they have, which is really rooted in making sure that they're well educated, that we have plenty of time to answer questions, and truly help them navigate the complex healthcare system that we currently work in. My patient care philosophy would be described as focusing on preventative care, patient-centered care, accessible care, with ultimately making sure that we are united in the care plan when it comes to achieving the patient's healthcare goals. One word that I would use to describe me would be comprehensive, and I'd like to think my patients would agree with that. When it comes to taking their medical histories, addressing their acute and chronic concerns, I would want to make sure that I've addressed everything very thoroughly, and to make sure that we are addressing all of the concerns that the patient would come in with that day. If not a physician, my younger former self would probably say to be a football player in the National Football League. But realistically, it'd likely be back in education as a teacher, whether it be the undergraduate level or the graduate level. What I like to do when I'm not working is to try to travel as much as possible. My wife is an avid traveler. Of course, I'll never keep up with her, but I do my best. For example, I proposed in Iceland and we got married in Bali, and so I want to make sure that we continue to see the world as much as possible. We have 3 pugs, and they're plastered all over my walls in my exam rooms for the kids, and I think everyone is able to enjoy them when they visit me. What I hope that patients get from our encounter would be that their autonomy's been very well respected, that it's been a very comprehensive and attentive visit, and that we have substantial goals that we've set and are able to establish a care plan going forward.